Welcome you all. I am Dr. PJ Madam Rafi. Today we are going to discuss about general anesthetics in anesthesia. Okay. So first of all, what is anesthesia? Anesthesia is loss of response to noxious stimuli. It is a reversible condition. That's why reversible loss of response to noxious stimuli. Okay. In anesthesia, we will have two. That is general anesthesia and local anesthesia type. General anesthesia means where loss of response associated with loss of consciousness, where patient will lose consciousness. That is general anesthesia. If consciousness is maintained, that is local anesthesia. This is the fundamental difference between general anesthesia and local anesthesia. That means general anesthesia where loss of consciousness will be present, loss of consciousness. Okay, patient will lose his consciousness. In local anesthesia, patient will maintain his consciousness. That is the fundamental difference. Okay. Next, general anesthesia, VHS. Obviously, unconsciousness, LOC will be there, loss of consciousness. Then muscle relaxation will be there. Next, analgesia. Next, abolition of compensatory reflexes. This is the main thing. Okay. When you are losing all relaxations, body will maintain some compensatory response. So, general anesthesia will abolish all those compensatory reflex responses. Okay. This is the main thing. Okay. What are the four? Unconsciousness, muscle relaxation, analgesia, and abolition of all compensatory reflex responses. Okay. Next, in general anesthesia, we'll have two types. Okay, one is inhalation anesthesia, that is gases and liquids. In intravenous, we'll have two types: fast acting, slow acting. In inhalational, gases will be, in that example will be nitrous oxide, Entonox, Gizina. Okay. In liquid form, we'll have chloroform, trilene, cyclopropane, ether, halothane, and fluorines. In intra, we will discuss each one in the following slide. Okay. In the intravenous group, fast acting will be thiopentin, propofol, etomidate, and ketamine. Slow acting groups will be benzodiazepine, opioids, and droperidol. Okay. We'll see following each one. So first is nitrous oxide. Nitrous oxide is also known as laughing gas. Okay. It is a colorless, non-irritating, non-inflammable. Main thing here will be how to remember the cylinder colors. Okay. This nitrous oxide cylinder color will be blue. Okay. In anesthesia, nowadays they are not asking. If they are asked, they have to ask the basics question, means they can go for colors of cylinders. Okay. So this nitrous oxide will have highest MAC. MAC means minimum alveolar concentration. Minimum alveolar concentration means it will produce unresponsive. That means if you are giving anesthesia, some dose, it has to be produced unresponsiveness in 50% of patients. Okay, that means if you are giving small dose, okay, anesthesia will be it is producing more potent, means it has to be producing more anesthesia. That means if you are giving large dose, but the anesthesia potency will be less, means obviously it will have highest MAC. Okay, so that's the major difference. So if you see here, this nitrous oxide will having highest MAC, that is minimum alveolar concentration will be highest. That means it is giving high dose to produce anesthesia. Okay, so that means it will be weak anesthesia. If you are giving high dose to produce anesthesia, means obviously weak anesthesia. If you are giving small dose, even that also it is reducing anesthesia, means it is potent anesthetic. Okay, here nitrous oxide it is a highest MAC number 104, but obviously when it is having highest minimum alveolar concentration, means we need to give more dose per to attain the proper anesthesia. That means obviously it is a weak anesthetic. Okay. Next is blood gas partitions. Okay, blood gas partition means it is a solubility. Okay, solubility of anesthesia. When the, for example, nitrous oxide for blood gas partition will be 0.47. That means it is very less. That's why its solubility will be, once we are injecting the drug, it will be soluble fastly. Okay, that means if we are, obviously it will be, induction will be fast. So obviously after metabolization also fast, recovery also fast. Okay, if the drug is having blood gas, that is BNG partition level will be very low, means it is having fast induction, fast recovery. Okay, these words are be very important in anesthesia: minimum alveolar concentration and blood gas partitions. Blood gas means solubility. Anesthesia concentration means we will see the potency. Okay, whether it is potent or not. And nitrous oxide is a weak anesthetic. It is not that much potent. It is a weak anesthetic. Okay. The major side effect will be methemoglobinemia. Okay. This is a major. Okay. This is an MCQ. Methemoglobinemia will be caused by some local anesthetics also, and General anesthetics also. In general anesthetic, inhale anesthesia, that is nitrous oxide. This is an MCQ. Okay. So you have to remember, you have to see the question clearly. If they are asking general anesthetics or local anesthetic. If it is general anesthetic, methemoglobinemia. Okay, it is also causes laryngospasm and it is contraindicated in pneumothorax and volvulus. Why means nitrous oxide is a gas. Obviously, it will enhance more this gaseous dilation. So that's why we will not use pneumothorax, because further it will cause aggravation of pneumothorax and dilation of intestinal obstruction. So obviously, we will not use in obstructive conditions like pneumothorax, volvulus, and inflammatory bowel diseases. So and eardrum affective cases. So in those cases, if you are using nitrous oxide, obviously it will cause more perforations. Okay, that's why we will not use. Next is halothane. Halothane is a colorless volatile liquid. It's a very volatile, non-irritant, non-explosive, and pleasant smelling. Okay, it is a good anesthetic but poor analgesia. Good anesthetic, poor analgesia. Okay, used in internal version of manual removal of placenta. This is an MCQ. Manual removal of placenta will be used by halothane. Okay, next is used in bronchial asthma patient because it is a bronchodilator. So we can use in bronchial asthma patient. Side effects will be mainly halothane. They are asking means they are asking the side effects only. Halothane will induce hepatitis, malignant hyperthermia, post-anesthetic chills and shivering. It will be overcome by giving pethidine injection. Okay, by giving pethidine injection, we will overcome by all these symptoms, post-anesthetic chills and shivering. Okay, this malignant hyperthermia, what we have to give? Dantrolene sodium. Okay, that's the main thing. So you have to remember the side effects: hepatitis, malignant hyperthermia, treatment for malignant hyperthermia, dantrolene sodium, post-anesthetic chills and shivering. Okay, that will be overcome by giving pethidine injection. Okay, next. Next is ether. This is also gas. So it is pungent smelling and irritant, highly inflammable and explosive. So we should not use cautery because of it is highly inflammable. So we should not use cautery. It is very good analgesic, muscle relaxant. It will induce bronchodilation. Main thing is it is causes hyperglycemia. So we can't use in diabetes patient. Okay, that is the main thing ether. Next one is enfluorine. Okay, enfluorine, it is a halogenicated ether. It is inflammable, contraindicated in epilepsy. It will rise ICT, so we can't use in CNS patients. Okay. Next is sevoflurane. Sevoflurane MCQ main thing will be it is the induction of agent for children. Okay, if you are using gaseous agent for children's surgeries, it is sevoflurane is the induction of agent. Okay, you should not use in closed circuit because it will produce nephrotoxic metabolite, that is compound A. Okay, that's why we should use in open circuit. We should not use in closed circuit because it will produce toxic metabolite compound A. Okay. Next is isoflurane. Isoflurane is it is an isomer of enflurane. Cardiac output is maintained. So obviously we can use agent of choice for cardiac surgeries. It doesn't rise ICT. So agent of choice for neurosurgeries and CNS patients. Safe in pheochromocytoma, but it will cause coronary steal phenomena. Okay. Isoflurane will be main useful in main two conditions, that is cardiac patients and neurosurgery patients, because cardiac output is maintained. So cardiac surgery patient will have to use, then neurosurgery cases. Next is methoxyfluorine. It is most potent. Okay, that is most potent means obviously least MAC. Minimum concentration will be 0.16. Okay, if you see that's the main difference. Least MAC means if I give low dose also, it is producing anesthesia. Okay, that's why least MAC. That's why most potent. Nitrous oxide will be high MAC where you need to give more. Okay, to getting anesthesia. That's why it is highest MAC, least potent. Okay, if you add, that's why most methoxyfluorine, if you see, it is most potent means least MAC, highest blood gas partition coefficient. Okay, highest means obviously B and G it have more solubility. That means what will happen? Slow, we need to give more. It is the solubility will be less. So obviously slow induction and recovery will be there. Okay, it will cause high output renal failure. Okay, next it should not be used in closed circuits. Okay, regarding methoxyfluorine, we have to remember the MAC numbers. Least MAC means it is 0.16. Highest blood gas partition, that means BNG blood gas solubility will be less, because if you are giving a drug, it has to take long time to get solubility. obviously it will take long time to dissolve, means obviously it will have slow induction and slow recovery. Okay. Next is cyclopropane. Cyclopropane is very important. It is highly inflammable. The color is very important. It is orange color cylinder will be there. Inhalation agent for hemorrhagic shock. Okay, this is an MCQ. Cyclopropane color will be orange color, used for hemorrhagic shock. Okay. Next group will be gases are over. Now coming to the intravenous agents. In intravenous agents, we will have thiopentine, ketamine, next other groups also there. So in thiopentine, it is a ultra short acting barbiturate, highly lipid soluble. So obviously it will cause brain. So have anti-convulsant action. Next, cerebroprotective. So, because why cerebroprotective means O2 consumption will be decrease ICT. So, obviously, when O2 consumption, intracranial tension will be decreased, means it will be cerebroprotective. So, you can use more in cerebral patients. So, it will induce hypotension due to vasodilatation. Main thing is it is contraindicated in acute intermittent porphyria patients. Okay. Thiopentine means it is a cerebroprotective agent more commonly used in cerebral patients. Okay, it is a IV agent. That's the difference. Next is ketamine. In the IV group, ketamine is very important. It is a phencyclidine derivative. Phencyclidine means halogenic agent. Okay, it is a halogenic agent derivative. Blocks NMDA receptor of glutamate. Very strong analgesia, but lacks muscle relaxant property. It doesn't have any skeletal muscle relaxant property. Main MCQ use, it is produced dissociative anesthesia. That means patient will be doesn't have contact with the surroundings. Okay, will have dissociative anesthesia. That means it will be psycho. That's why it is hallucination. Patient will have in hallucinations. He will be in some hallucinogenic phase. Okay, that's why it will produce dissociative anesthesia. You will not have contact with surroundings. Okay, that patient will be speaking and he is doing activities, all those things, but it doesn't will have contact with the surrounding people. That's why it will produce dissociative anesthesia. Next is it is agent of choice for emergency intubation. That means if you are doing any emergency, we need any emergencies and situations, because normally we will do intubation. Obviously, it will cause as food aspiration. Okay, so when you are using in that emergency RT means road traffic accident, RTS, all those situations, you have to go for emergency situation. Okay, emergency intubation. In those patients, we will use ketamine because it will increase gastric pressure, thereby it will inhibit the food aspiration. Okay, because normally when after food, obviously when you are intubate means food aspiration will be there. Okay, so to prevent food aspiration, we will use ketamine in emergency intubation conditions. Okay. Next is it will increase all pressure. That means intracranial tension, intraocular pressure, and BP. Okay, this is the main MCQ. Ketamine will increase all pressures. Next, it is the agent of choice for emergency intubation. That means full stomach patients. Okay, to avoid food aspiration, we will use ketamine. Next is the main side effect is obviously it is a hallucinogenic agent, so patient will have hallucinations. Okay, next. Next group will be propofol. Okay. In propofol, obviously it is a milky white powder, oil-based preparation. Main thing is propofol is a very painful, very painful injection. Strong antiemetic, antipruritic action will be there. It has no muscle relaxation property. Myoclonic jerking, muscle twitching will be seen, but no muscle relaxation property. It is the agent of choice. Okay, it is the IV inducing agent for daycare surgeries. This is an MCQ. Daycare surgery IV induction agent will be propofol. For any daycare small procedures, we will give propofol because it is painful, but it is the fastest induction will be there. Once we are giving, it will be fast induction. So we will use for daycare surgeries. Okay. Next group will be etomidate. Etomidate doesn't interfere with cardiovascular functions. It is the agent of choice for aneurysm surgeries and cardiac disease. So we will use because it doesn't have any interaction with cardiovascular. So we can use in cardiac patients. Next, it will cause adenocortical suppression. Side effects will be obvious nausea and vomiting. Okay. Next and last is benzodiazepine groups. Benzodiazepine groups will have diazepam, lorazepam, midazolam. Obviously, these are all seance drugs, so muscle relaxant, anti-convulsion property will be there. In lorazepam, for pre-anesthetic medication, most commonly used lorazepam. Okay, That's why lorazepam is the most common used drugs in pre-anesthetic medication to avoid this anxiety, all those things, because pre-anesthetic medication we have to make the patient calm and relax. So we will use lorazepam to as a pre-anesthetic medication in benzodiazepine group. Okay, next will be midazolam. Midazolam is used for daycare surgery. Okay, so our next group will be opiates. Opiates will have fentanyl, alfentanyl, remifentanil, and sufentanil. Among these things, sufentanil will be most potent. These drugs are 100 times more potent than morphine. Okay, so if you see, all these drugs are more potent. Okay, next alfentanil will be used in daycare surgeries. Remifentanil among in this group, remifentanil is shortest acting. Next sufentanil is most potent. Okay, next and last will be neurolept anesthesia. Neurolept anesthesia means here we are using opiates along with other agents like nitrous oxide, and like opioid drug will be fentanyl and droperidol, that is G2 blocker. Okay, here we are using a combinational group drugs. That means along with opioid we will use nitrous oxide, that is gaseous agent, and droperidol D2 blocker to produce analgesia. It is a means here patient will be doesn't lose his consciousness. Okay, patient will be having, it's a different anesthesia mechanism. Like in local anesthesia, patient doesn't have loss of consciousness. Samely in neurolept analgesia, here also patient doesn't lose his consciousness. Okay, but it will produce profound analgesia. Patient will have severe analgesia, means more pain relief will be there without loss of consciousness. Okay, that's why it will induce profound analgesia without LOC. There will be no loss of consciousness, but analgesia will be very high. Okay, so what are the conditions we use there? This endoscopy when patient is in consciousness, but patient will be very comfortable because there will be no pain, so patient will be very comfortable. Angiographies like CT angio, then coronary angio, all those things. Then bun patient dressing is very severe pain condition. So in those patients we will not use more CNS depression CNS depression drugs. That's why we use neurolept analgesia. That's why it make patient calm and allow for dressing. Okay. The major side effect of this neurolept anesthesia will be EPS, that is extrapyramidal symptoms. Why? Because they are blocking D2 blocker. Okay, that means dopamine blocker. It is a D2 blocker, obviously because EPS. Okay. Main in neurolept anesthesia will be, main important point will be, it is produce profound analgesia without LOC, that is without loss of consciousness. It will produce profound anesthesia. Okay, this is the main thing regarding general anesthesia. That's all. Thank you.